Hi everyone, my name is Ashley and I decided to do my final project on obsessive compulsive and related disorders. So I chose this because there's so many different forms of OCD and there's subcategories ranging from even major and minor conditions, and it can affect uh, everyone at all ages, from childhood all the way through young adulthood. And I feel it's a severely misunderstood subject. It's been really interesting for me to learn about the evolution of this. So here we have our table of contents. We'll start with the history, work our way through risk factors, obsessions, compulsions, even to the future. So starting with the history of OCD, symptoms can be traced all the way back to the 14th century, but back then it was thought to be elements of scrupulosity, which nowadays that's considered a subtype of OCD, and it refers to a person's obsessive concerns with their own sins. So all the way until the 17th century, it seems that OCD symptoms were actually considered to be, you know, religious devotion. And even in the 17th century, it was described as anti-Christian thoughts. So it wasn't until the 1830s that a French psychiatrist was actually among the first to recognize that people with OCD were able to function in many areas of their life despite having these symptoms. You have in the 1870s a man by the name of Carl Friedrich Otto Westphal actually came up with the term for obsessions, which here in the US translated to compulsions. So they had to compromise on the term of obsessive compulsive disorder. Moving on to the 20th century, Sigmund Freud did some work in it, but it really wasn't until the 1950s that the Diagnostic and Statistical Manual of Mental Disorders was published, and it actually included OCD as a specific psychiatric diagnosis. So when you're defining OCD, you have to remember that it's a whole group of disorders that all involve the same intrusive and unpleasant thoughts as well as repetitive behaviors. A lot of people even have a tic disorder, which what that means is you can have motor tics or vocal tics. So rapid eye blinking, head or shoulder jerking, throat clearing, or even grunting sounds. And it's actually pretty common for people with OCD to already have a diagnosed mood or anxiety disorder, making it hard to diagnose in itself. However, the symptoms can begin anytime. They usually start between late childhood and young adulthood. However, it's usually young adults that are diagnosed with this disorder. And symptoms can start slowly. They can go away over time. They can worsen. During times of stress, symptoms can get worse. And the obsessions and compulsions can actually change over time altogether. But it's according to the APA that approximately 2.3% of the US population will experience some form of OCD in their lifetime. So moving on to risk factors, obviously genetics. So if you have a first-degree relative like a parent or a sibling with OCD, you have an increased chance of developing it. If you have suffered a childhood trauma, or if you exhibit more reserved behaviors such as depression and anxiety as a child, you're more likely to develop it. But also, there's been brain imaging studies that people with OCD have differences in the frontal cortex and subcortical structures of their brains, and those areas are the ones that impact the ability to control behavior and emotional responses. And here we just have an image showing a normal brain versus a obsessive compulsive. So moving on to obsessions. Obsessions are long-lasting, unwanted thoughts or urges, and they can be intrusive and cause a lot of distress or anxiety. So they have different themes, such as fear of contamination or dirt, otherwise known as, a germaphobe, maybe. But you can also have needing things to be orderly and balanced, doubting and having a hard time dealing with uncertainty, or even aggressive or horrific thoughts about losing control and hurting yourself or others. So a few examples of obsession symptoms include doubting that you've locked the door or turned the stove off, having intense stress when objects aren't orderly or facing in a certain way, images of driving your car off a cliff if you want to pull a Thelma and Louise. And then you can also have thoughts of behaving inappropriately in public as well. Moving on to compulsions. Compulsions are repetitive behaviors that somebody feels driven to do. They're meant to reduce the anxiety in that person. However, obviously that doesn't necessarily happen. But compulsions also have themes as well. So washing and cleaning, you've got counting, ordering, checking, folks who have to follow a strict routine or even demanding reassurance. But some examples of compulsion symptoms include washing your hands until your skin becomes raw, counting in certain patterns, checking the doors over and over again to make sure that you remember to lock them, or even trying to replace a good thought with a bad thought. So moving on to subtypes. The subtype is actually a way that OCD affects a person in a particular way. So you have different kinds. These are just a few examples. One that everybody is probably familiar with is hoarding disorder, which is when a person cannot bear to part with their personal possessions, regardless of how valuable or useless they are. And over here is an example of a hoarding disorder. So moving on to treatment, unfortunately, there's no actual cure for OCD. However, there's a lot of different treatments and therapies that can help bring the symptoms under control so that somebody can live, a better life, pretty much. The two main treatments for OCD are psychotherapy as well as medicine, and using both treatments is actually the most effective way, but you can also work with a mental health professional to help manage these symptoms. And here are just a few examples. So for medicines, you have your antidepressants. You can also do deep brain stimulation for adults 18 years and older. There's also rehabilitation treatment programs. But another way that you could treat it is actually a way that a group over in India started developing. It's actually stimulating the vagus nerve. So with the vagus nerve, that aids in controlling the nervous system. Therefore, it helps in controlling emotions and how the body responds to stress. So I provided a link to the article below, but the results of the study actually proved that the vagal nerve stimulation plays a very significant role in reducing the symptoms of OCD. Okay, moving on to the future. So as OCD becomes more clear, there's a need to continually reevaluate the implications of research findings, and you need to incorporate those new findings into new treatment approaches that can benefit both the patients and the clinicians. So, for example, a few things that are up and coming are robot models of obsessive compulsive related disorders. They're looking into problematic use of the internet. There's also something called digital interventions and technologies, which below I shared a link to an article that's describing the importance of taking different approaches to deliver certain interventions, such as digital technologies. And it even mentions exercise, music, and art therapy, which, although evidence hasn't shown a whole lot on that helping people with OCD, it's up and coming. All right, so to conclude the whole presentation, basically the understanding of OCD has really come a long way from the 14th century when people just thought it was anti-Christian thoughts. However, it's still evolving, so the treatments have to evolve with it. Psychiatrists are continuously coming up with new methods to help individuals so that they can have a better quality of life. So if you have OCD, you have to remember it is not the end of the world. There are so many ways to help manage the symptoms so that you can feel better.